Night of the Live Gamer on TikTok. Hello, everybody. I am Dr. Rahi Victory, host of Fertility Fact or Fiction, and we have an impromptu 1 hour live that we gave very warning about because we weren't sure exactly what time it was going to happen, but we are here to answer your questions. There are still no interesting new articles to share, and we were kind of behind in questions. Did you get a chance to screenshot the questions last time or no?
I have a bunch
From before?
for
Oh,
sure.
well, if we don't have enough, we can answer those. And so all sorts of people are jumping on TikTok and YouTube, Twitter, now known as X, Facebook, and Instagram. And we haven't done LinkedIn yet. We got to get on LinkedIn. Can you do a live on LinkedIn?
Yeah, I'm sure we can look into it.
We got to add LinkedIn. Can you do it with the yellow duck thing?
So.
Yeah.
I should be able to.
We should try that. That'd be cool. Hello, everybody on TikTok. We got our TikTok friends jumping on, and we are happy to answer your questions, all things related to infertility. Don't hesitate to ask anything you want to know about. We are prepared to answer. And I'm Dr. Rahi Victory, your host of the show. My wife is away because she went to see the opera, and Tarek is fasting, so he had nothing to do. So we figured we would do this, especially since he's going to be overseas on Tuesday of this week. And so I don't know how we're doing that. What are we doing for that?
I got it taken care of.
You're going to be, somebody else will be doing it, or you? We don't know.
It's supposed to be somebody else.
But it might be you.
Somebody else keeps disappointing.
Okay, so how far ahead, what's the time change difference?
Tuesday I leave Monday, so this Tuesday I'm not here.
Yeah, that's what I'm saying. Next Tuesday you're back.
Next Tuesday I'm back.
So what's the time difference between here and Turkey?
7? I think 6, 7, something like that.
Oh, yeah. So that'll be 2, 3 in the morning.
If we'll do it. Don't worry.
That'll be 2 in the morning for you. Ouch.
You're frozen here. Hold on.
I'm frozen.
On Restream.
So what questions do you have?
Oh, you're good.
We're good?
Yeah, you're back.
We are interested in your questions. Otherwise, Tarek will pull up some questions from before and we can answer all of those. There's questions already?
Vis-a-vis the internet, sir. Of course.
Oh, there's one here from Sarah. Best days in the fertility window to have the highest chance of conception. Same day that you're ovulating is the best chance. And the 5 days leading up to it are reasonable, although it gets lower and lower the further out from ovulation you move. So best day is the day of ovulation. Next best would be the day before, and then the day before that, and the day before that, and the day before that. That one was easy.
Easy.
A gimme.
All right. Hi, can you tell something about Pergoveris 900, 300 per day, and the capital? I have a low AMH 1,1. Other hormones are okay. Thanks.
Well, Pergoveris is a combination of gonal F with a half ratio of Luveris, which is recombinant LH. So essentially you're taking, if you're taking 300, you're getting 300 units of gonal F and 150 of Luveris. That's what Pergoveris is. It's a good drug. I don't use it very much because I don't love Luveris, but it's a good drug. We use it from time to time. And when there was no Menopur available, we had to use it because there was nothing else to use. So reasonable. Some people love it. It's not what we use. I love Serono. I love their products. We use Gonal F all the time, but we tend to mix it with Menopur. So yeah, as far as will that work for you or not, there's no way to know. You'd have to try to see. Your AMH is quite low. So you're on a medium to high dose of medication. Not unreasonable, but I would want to see how you respond before I made any further decisions.
When to stop progesterone in early pregnancy?
12 weeks is what we do. You can stop earlier, but we wait till 12 weeks.
Hi, Dr. V. I have endo and adeno. My doctor is advising for 3 to 4 months of Lupron, letrozole, and take 5 milligrams of letrozole for 14 days instead of 5 days while preparing for lining. Your thoughts? And can we do it?
I've never heard of someone taking letrozole for 14 days to prepare for lining. In theory, that's going to keep your lining really thin by blocking all the estrogen. So I don't know that I would do that. But Lupron and letrozole ahead of time, I mean, that's our protocol. It looks like it's finally catching on. So you're doing the right thing initially, but beyond that, probably could be optimized. Don't do 14 days.
Hey, Dr. VNT. Dr. D said if TH1 and TH2 is managed, lowered with Humira, Tacro, then you don't need IVIG. Do you agree?
Well, if your only problem is your TH1, TH2, yes, that would be true. And that's why we use Tacro for that, or Humira.
Does hydro lower cytokine and NK cells?
No, hydrosalpinx increases cytokines and NK cells, assuming you're talking about hydrosalpinx.
Dr. Alan Beer's book says IVIG is important for TH1 and TH2 cytokines. You just said you stop at 12 weeks, but you have stated that you should continue to take prog long term, like in Sab's case.
Yeah.
That's the question.
Well, you can't continue IVIG the whole pregnancy. It's too expensive, number one. And number two, fertility patients are at higher risk of preterm labor, and the progesterone has been proven to reduce preterm labor. So that's why we continue it. IVIG has nothing to do with that. And once your pregnancy is well established, there's no real need to continue the IVIG. So we don't do that past like 6 to 12 weeks.
We need to get some likes on TikTok.
We need to get some likes on TikTok. Tarek wants you to like on TikTok, guys. I don't know why, but anyways.
Yeah, I like seeing likes. I like seeing
Oh,
likes.
single mother by choice is back.
Yes, she's the one
Yeah.
that asked those questions.
Oh, yeah. Okay, cool.
Um,
Someone's throwing up likes for you. There you go.
I appreciate that. I appreciate that. It looks good in
Yeah.
the thread. As
Yeah,
well.
and TikTok is telling us to tell you to invite other people to watch us, but that's
Yes,
a whole
invite
other
other
show.
people to watch.
Invite
If you know
other
someone that's also going through this path,
invite them to watch.
yeah, they don't need to
Agreed.
walk alone. Isn't
Yeah.
that the thing?
That's right. No one walks alone
No
up
one
here.
walks alone.
Now it should be no one watches alone.
That's it. No, it should be a popcorn party.
Yeah.
What supplements should I take before a transfer? Unexplained fertility, first transfer was successful.
Your prenatal omega-3, like the fish oils, melatonin, vitamin D, iron. That's it.
My immune testing showed my LADs are low. I've had 3 failed transfers with normal embryos. Do you think my low LADs are the reason for implantation failure? Should I try litness?
I mean, I don't know everything about you, and I would need to know everything about you. I can only say that lads could be part of the problem, so it's worth investigating. But I need to know more about you. I can't answer questions where I don't know the patient or don't know everything about you. Single mother by choice is asking 2 separate questions. I was asking, when is it a good idea to continue Proj long term? We continue Proj long term for everybody. So we continue it till 36 weeks for all our patients. And Margot, can you tell me why I should do HSG if I'm doing IVF anyway? If your tubes are swollen or damaged, they need to be removed. It's a 50% reduction in success. 50.
Last embryo possible endo waiting for lap UK 1 year wait.
Mm-hmm.
Next natural FET protocol is progesterone suppositories and injections. Pred, intralipids, waiting for fertility results. Anything else?
Tacrolimus, and then the supplements. So NAC, curcumin, resveratrol, ALA, and coenzyme Q10.
If I suppressed with Lupron and letrozole and my transfer failed, does that mean endo is not likely the issue?
If she took Lupron and letrozole and her transfer failed, no, I mean, it could still be endo. Remember, Lupron and letrozole are treatments, but they're not by any means guaranteed to give you success. Having said that, if you failed, we would offer you additional testing to see if there are other things going on, like fertility testing.
Hi, Dr. Victory. My husband and I are doing our first lit in April before our FET in hopefully July.
Yeah.
We are doing 2 sessions. How will we know if we need more than 2 sessions?
You'll get tested for your LADs after the second treatment, 1 month after the second treatment. So you need a repeat fertility test. By the way, my back is out. My whole back is in spasm. So if you see me like squinting or looking like I'm in agony, it's because I am.
How long do you take progesterone before the transfer?
5 days for a day 5, 6 days for a day 6.
Hi, Dr. B. I'm looking to get pregnant naturally, not use IVF. I have low AMH. Would ovarian PRP be something beneficial? And does your clinic offer it?
Yes, we do, and no, you shouldn't. It won't help you at all. It has no impact on egg quality, just egg count. So it's not going to help you. You don't need to use that. Save yourself the money.
My fourth IVF transfer worked, but we lost at 13 weeks,
Oh.
missed miscarriage.
I'm sorry.
Baby stopped growing at 9.5 weeks. Is it likely linked to my adeno or immune? I was on pred, intralipids, and Levanox.
Hard to know. I would need to know more about you. It certainly could be immune. It could be related to adeno. It's more likely related to the embryo itself, in that the embryo may have been abnormal, but it could be the other things as well. So I would have a look at all of that. By the way, if anybody knows how to get back muscles out of spasm, please send me your comments.
I have no clue.
I've tried everything. Massage twice. I tried acupuncture, which I've never done before. I didn't even feel the needles go in. Have you ever had it?
No.
I felt nothing. Like I literally felt nothing. It's like just like a tap. You don't feel a thing.
Get strong with it?
Yeah. And then I've tried heat. I've tried cold.
Heat, I hear works.
You know those salon pass? Have you seen those? It's like Vicks Vapor Rub in a wafer. You stick it on you like a sticker. That actually works.
I hear heat is wonderful.
No.
Really?
Hot bath killed me.
Really?
I was dying. Yeah, it was a bad idea. Yeah.
Also, does adeno increase NK cells?
Yes, probably does. Yeah. I mean, it's going to be different in everybody, but it probably does.
Pregnant 2 times in the past 2010 and 2011 naturally, 3 medicated transfers within the last 6 months. The last one was with your endo protocol. Would you try a natural or modified natural cycle next?
Well, our endo protocol is a modified natural cycle. So if they did a endo protocol and then they did a medicated stim for your FET, then that counteracted the endo protocol. So yeah, I mean, that's the wrong way to do it. Single mother by choice has a bunch of questions.
Do you agree?
You have to go back up.
Yeah. Okay. Yeah, 36 weeks for me per email. I don't love it, but I know it's worth it. I just had a lab and found stage 1 endo. My doctor says stage 1 removed. Doesn't need Lupron suppression. Do you agree?
No, I don't agree.
What role?
You can't see all of the endo. There's always going to be some more. So even if we zap all the stuff we see, we haven't got it all.
Preach. What role do prednisone and ASA have in fertility treatments?
It depends on what's wrong. ASA is good for blood flow. It can potentially increase the number of eggs you get. It probably reduces miscarriage rates. It may improve implantation. We don't know for sure. Prednisone by itself, it probably doesn't do a whole lot, but in conjunction with other stuff, there are studies that show benefit. It doesn't have any other significant effects. Richard Scott did a study that he never published showing that it was beneficial when you're doing day 5 blastocyst transfers, but again, he never published it, so I'm taking it on face value from personal communication with him. It was a big study, though. They had thousands of patients in it.
Hi, Dr. V. Thanks for answering. I wanted to tell you my doctor is advising 14 days of letrozole plus estrogen patches while increasing the lining after Lupron. Can it impact lining even on patches?
Yes, and you shouldn't be on letrozole and estrogen at the same time. It makes no sense. You don't need that. Just stop the letrozole and let your lining develop by itself. You don't need the patches. Most of the time you don't. Yeah.
Do you recommend acupuncture for IVF?
I do if you like acupuncture. I just did it for the first time ever myself the other day. I didn't get relief from my back pain, but that's for back pain, and my back is very bad right now. So for people that get less stress doing acupuncture, they feel more calm. It's beneficial. For people that feel more stressed, then don't do it. It's probably detrimental.
Uh, Sound paths are great. Massages usually take a handful of sessions for me if
Yeah.
if it really flared up.
Oh,
Multiple sessions, they say.
yeah. It's bad. I
Do
got
I need
I got beaten up by my masseuse the other day.
do I need to do your endo protocol if I just had it removed?
Do you have to? No. Should you? I mean, I would argue yes.
Please try chiropractor. I recently had back issues and it worked for me. Hope your back feels better.
Yeah, actually, I got the name of a good chiropractor today, so I might give that a shot. You
But be
never
careful,
know.
I've seen a lot of those chiropractors.
Uh,
Some of those moves
You crack, break. I know. I had shoulder impingement, and I saw a chiropractor. Honestly, it
wasn't,
didn't do anything.
yeah.
I was not
Just be
any.
careful, man.
Wasn't any better from
I
that
see
at
these
all.
videos on TikTok all the time. They're like doing stuff and then head rolls off the table. You know what I mean? Be careful. Be careful.
Ow! Ow! Oh God, that hurt. Don't make me
I'll
laugh.
take it easy. I'll take it easy.
Carly's got a question. Is there any data supporting exercises turning breech babies? Do I really have control? Yeah, actually, when we get you to go on all fours like you're crawling, it opens up everything in the pelvis and helps the baby turn. Plus, we can turn them in some people. So don't worry. If that's a thing, Car, we'll talk about it when I see it. Yeah.
What could cause preterm labor?
Number one cause of preterm labor is infection. Number two would be a weak cervix or a misshapen uterus. Other causes, who knows? But the number one is infection in the uterus.
What is ASA?
Acetylsalicylic acid, aspirin.
Oh, acetylsalicylic acid. So that's a tongue twister, I think. The endo protocol you shared didn't have any mention of trigger in it. Is that a modified natural protocol? Do we need a trigger in that?
No, we don't trigger. I find it just makes things go crazy. So we ignore the trigger. There's no benefit to a trigger. So we don't use a trigger.
30,000 IUs of vitamin D, back pain spasms.
Oh, take vitamin D for the back pain? Oh, that's interesting. I might try that.
It's like the whole bottle, 30,000.
That would be a lot.
That's a
But,
lot.
well, you can get cholecalciferol, which is the 50,000 unit one pill.
That's like a monthly pill or what?
It's a weekly pill
That's
that
a
you're
weekly
supposed
pill.
to take. Yeah. And granted, because I'm indoors 24/7,
Of course.
I probably have zero vitamin D.
Nobody has vitamin
I'm
D.
I'm going to try that. I will try that. Yeah.
This is yeah, Dr. V, I'm bleeding 8 weeks pregnant.
Oh,
I'm your patient.
okay.
I'm scared.
Go get checked out. Yeah. Go to OB triage and get checked out, please. Right away, because we don't want to have you have an ectopic and not know about it.
Why does endo hurt embryo transfer?
Inflammation, overactive immune system, unfavorable implantation zone, mostly related to immune function. So it makes your immune system really aggressive, and the immune system wants to attack everything it comes into contact with.
Back to HSG.
Okay.
Why do my tubes need to be removed if they are blocked? They have been removed.
Huh? I don't get it. So if you still have your tubes and they're blocked, if they contain inflammatory fluid, like they're swollen, that fluid is harmful to embryos. So I had a patient the other day who had a blocked tube, and I recreated the end of the tube for her by opening it up and making it like a normal tube again. So that will let the fluid pass through, hopefully, And so she should be fine after that. But if the fluid is plugged in there, it's blocked, it can't get out of the tube, that fluid is embryotoxic. So we know from studies that you get a 50%, 50% reduction in IVF implantation if your fallopian tubes are swollen and filled with fluid. So they need to be removed for that reason. But if they've already been removed, you don't need to do an HSG, and you definitely don't need to have your tubes removed because they're already gone.
So, someone with PCOS
Yeah.
and don't even get a cycle, what helps other than the pill?
Well, it depends if you're trying to get pregnant or not. And it also depends if you're thin PCO or not thin. So if you're thin PCO, you need medication of some sort. If you're not thin PCO, weight loss is going to be integral to your success. There's letrozole, there's supplements, you can use metformin. All of those things will help. Diet, lifestyle, exercise, many different things can help you. So we usually run through all of those with our patient and try and build a whole kind of approach for them that involves medications, natural approaches, and lifestyle changes.
Took 3 cycles to conceive last pregnancy, which ended in a 30-week stillbirth.
Oh, sorry.
We are past 3 tries now. Should we be concerned?
Depends on your age. So yeah, I mean, I would want to know what's going on and why you had a stillbirth and how old you are. So probably worth talking to your doctor and see if you're at an age where you need intervention.
Is there any evidence that doing a transfer right after a chemical pregnancy results in higher success than waiting?
No, no evidence either way. It makes no difference.
If I have embryos elsewhere, under funding, can I consult with you about how to make the next transfer successful?
You can consult with me. I can even give you a plan. But fertility specialists are uniquely stubborn people and they don't always listen. So even if I give you a plan, you may not be able to implement our plan because your fertility specialist may refuse. We've actually had quite a number of people refuse to use our protocol, which is silly, but whatever. If that's what they want to do, that's what they want to do. So you're welcome to consult, but you may not get the treatment you need unless you move the embryos to us because fertility specialists don't like to play nice in the sandbox. Yeah.
Does low membrane integrity just mean poor egg quality? And would Cezanne help? 50% of my mature eggs didn't survive ICSI.
Wow. Didn't survive the ICSI? That doesn't make sense. Yeah, I mean, low resistance eggs are considered not great eggs, um, but they should survive the ICSI. So I would want to know who did your ICSI. Um, Most of the time, they should survive the ICSI. But if they didn't survive, then yeah, there's clearly either a sperm problem or an egg problem or a technical problem. It's got to be one of those three.
How often after a C-section can I do another FET?
Well, minimum 3 months, preferably six, so you're breastfeeding for 6 months.
Curious what to do with fluid in the uterus 6 days into an
Oh,
FET.
yeah, it's tough. So if you have an isthmusele, you need it resected or burnt. If you don't have an isthmusele, you got to check for your fallopian tubes to see if they're damaged, and they may need to be removed. Sometimes we get away with the fluid disappearing when you start the progesterone, but not always.
Do you offer consultations for advice while undergoing IVF in the UK? I
Yeah,
guess it's pretty basic here and looking for advice on moving forward.
we do all the time. In fact, we're headed to the fertility show in the UK in a couple of weeks. So absolutely we do. Happy to help you out. We have probably about 5 to 10% of our patients are from the UK. And my daughter's going to be going to med school in the UK. So yay, Jenna. I don't know if she's watching. She's in the library studying
She
right
hasn't
now.
commented yet. Usually she complains that I
Yeah,
didn't
I
answer her
know.
question. So
I know.
so far she's not here, I don't think. Hi, Dr. Victory. I would love to hear your opinion about traveling by plane in the first trimester if you are in 9 to 10 weeks pregnant.
Not a problem. fire away. Otherwise, stewardesses would never be able to be pregnant. It's fine. There are slightly higher risks, but it's very small.
Curious. What to do with what to do with the fluid in the uterus 6 days into FET? RE thinks possibly cervical mucus. Does Mucinex work? How? That's I have to remember the exact timestamp of that reaction because that's gold, baby.
Fluid in the uterus has nothing to do with your mucus. It's either from an isthmosele, which is a C-section scar, or from your fallopian tubes, or from infection. It's got zero to do with cervical mucus. Zero. Where do people come up with this stuff from?
I think she's got to switch.
Yeah, you need to get a saline infusion sonohystogram and look for a cesarean scar defect. It's the #1 cause. Then you got to do your same saline infusion sonohystogram to assess the fallopian tubes and make sure you don't have an hydrosalpinx. And if it's neither of those, then probably Fertility to check for infection. It has zero to do with your cervical mucus. The only other possibility is your cervix is so tight, it's so stenotic, nothing is getting out of there. That's a possibility, but it has nothing to do with mucus. And no, Mucinex is not a solution. I couldn't control that one. I tried. Oh, I'm not good at being politically.
It's a Saturday show.
It's a miracle.
It's a wild show today. Anything goes.
It's a miracle we haven't gotten in more trouble because,
trying to behave.
I try to behave, but I sometimes they just
it slips out.
Yeah. Yeah.
Is there any other testing from Fertility you recommend besides full microbiome testing for failed transfer?
Well, their immune testing helps. Yeah, so that's the other part. We do their immune and their microbiome.
Thoughts on NMN for low AMH and low follicle counts?
NMN? Not familiar with NMN. It's a short form I'm not familiar with. If you're talking about naltrexone, I'm not convinced yet, but I'm not sure what NMN is. Yeah.
Stibbard Chiropractic on Wyandotte is the best husband and wife duo.
What's the name?
Stibbard.
Stibbard?
STIBBARD.
All right. I got Tony recommended sarsaparilla or something like that. It looked like sarsaparilla, but it wasn't. It was like, yeah, something else. My phone is currently filming TikTok, so I can't check. Yeah.
Google anything.
Yeah.
Hey, Dr. B and Dr. T. Oh, wow.
Oh, you love the Dr. T. Yeah.
I believe anybody would.
Yeah.
You must feel pretty good on a regular basis then. If I'm understanding this correctly.
It's like my daughter who thinks she's a doctor just because she got into med school. Yeah, she's like, I'm a doctor now. I'm like, no.
You know what? We should have a show.
Yeah.
Me and her.
Yeah.
Answer fertility questions. See if you do better.
You'd probably do better.
I would probably do better.
You probably would. Yeah.
All right.
Although she knows her stuff already.
Course.
She does. Yeah.
Dr. B and Dr. T. Do you think omeprazole high dose for a prolonged time could affect prolactin levels for fertility in general?
Prolactin levels?
Mm-hmm.
I'm not aware of a connection between omeprazole and prolactin levels. We're actually about to start a study using the cousin of omeprazole to see if we can improve frozen embryo transfer rates, because supposedly it relaxes the uterus. So no, I don't know of a connection between those two. I'd have to look it up, but I'm not aware of a connection between the two at all. SMBC had a question about our protocol. It's the last thing I saw from her.
What does endo hurt embryo? No.
How does endo hurt embryo transfer?
Why does why does endo hurt embryo transfer? We did that one.
Yeah.
So someone with PCOS doesn't even get a cycle. What helps other than the pill?
We talked about that.
What are the tests you would recommend after a failed transfer?
We did that one.
Yep. Mucinex, does it actually work?
Mucinex works for guys with thick sperm. Yeah.
Oh, that's what that's for?
Yeah.
And she wanted to take it?
Well, she's thinking it might help her with her
Mucus.
cervical
Oh,
mucus.
interesting.
But you got to have like cystic fibrosis to have mucus that thick.
Mm.
Most women aren't that bad.
Can MTHFR homozygous positive cause recurrent pregnancy loss?
Yes, definitely.
Should I do a hysteroscopy if I've
You need
had
aspirin
failed
and heparin.
transfers?
No, you should have a saline infusion sonohysterectomy. Everybody's jumping into hysteroscopy. Hysteroscopy is not of benefit, and it's a surgical procedure with risks compared to a saline infusion sonohysterogram, which tells you almost everything a hysteroscopy does for a fraction of the price and zero risk. I don't know why people do that. In the US, no one's getting SIS. They get a hysterosalpingogram, which is dinosaur medicine, like truly dinosaur medicine. And then they get a hysteroscopy the minute they think they can't make it work or something. And it's like thousands of bucks to do all this stuff when all they needed was
So they
a
either got
saline
dinosaur
infusion.
stuff or super aggressive stuff and not what the first patient actually needs.
Right. It makes no sense.
America.
Like your ultrasound will tell you everything you need to know. And then, yes, if you see something on the ultrasound, you go and you do the hysteroscopy, you fix it. But if there's nothing on ultrasound, why are you knocking people out and dilating their cervix? I don't get it. Doesn't make sense, guys. Yeah. Wait, I got to answer that SMBC question. She said, how does the lining thicken after our endo protocol? It does, because the Lupron wears off. And the letrozole, by extending it 5 days past the time of the Lupron, the 90 days that the Lupron works, the letrozole will impact the growth of your eggs. And if you just stop, your lining in most cases will come back. Yes, some people need a smidgen of estrogen, but a smidgen, 1 milligram, 2 milligrams max, and then they're fine and they're ready. Is it going crazy?
Yeah. YouTube's pretty alive today.
Wow, cool.
Hi, Dr. V.
I do love our YouTube.
YouTube's great.
Yeah, we passed 2.5 million views.
I saw it.
That was a big day. Yeah.
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 Hi, Dr. V. I'm 42 years old. My labs at second cycle day are estradiol 29. Oh, you might want to, there's some numbers coming.
Okay.
Estradiol 293 picomoles per liter.
Okay.
Prog 0.8 nanomoles per liter.
Okay.
FSH 11 IU over L.
Okay.
AMH 2.4 picomoles per liter. I get LH surges on ovulation kit. Do I have a chance for natural?
You always have a chance for natural. Your AMH is really low, so it's going to be difficult, but there's always a chance. Yeah.
Oh, Dr. VNT. How to get pregnant with Hashimoto thyroiditis?
Well, I probably wouldn't try getting pregnant while you have Hashimoto's thyroiditis. If you have the active flare, I'd wait till you settle. Once it's settled, just make sure your thyroid's under control and fire ahead the good old-fashioned way. I like today's questions. They're easy ones.
Hey,
They're quick answer questions.
nothing wrong with that.
No, for once.
For
Rapid fire.
I went to my OB. Baby heart is okay, but they don't know why I'm bleeding.
Make sure you're not on any blood thinners. I would probably take it easy, pelvic rest. Don't lift anything heavy. Don't strain. Make sure you're on progesterone. That's what we would normally suggest.
Soraya's here on the show. She says, Habibi, Joe.
Hello, Habibi. How are you?
Okay.
Yeah.
So
It's the first time we've had a reasonable time for Soraya.
yeah.
It's midnight.
We're doing it for her today.
12:30. Yeah.
Okay.
Yeah.
So then why did I get hooked for an HSG? My tubes were removed. Ha ha ha. I'm confused now.
I have no idea. Unless they were trying to make sure your tubes were blocked, or they were trying to figure out something about the shape of your cavity. I don't know why else they would do it.
Did you see they discovered a bacteria that may be related to endometriosis?
Yes.
And the cause behind it?
Yep, I did see that, and it's interesting, but it's not convincing yet. But it is interesting for sure.
Adenomyosis versus endometriosis. What's the difference?
Adenomyosis is essentially endometriosis in the wall of your uterus. Endometriosis is the presence of the cells from inside the lining of the uterus outside of the uterus. So adeno is in the uterus wall, endo is outside of the uterus completely, on the outer surface, the ovaries, the tubes, your pelvis, wherever else it goes.
Plan to use your endo protocol for FET along with that. My doctor says to use 3 doses of 0.1 milligrams of
Decapeptyl.
every
Okay.
3 days, starting with progesterone. Doctor said it helps implantation. Your thoughts?
Not aware that it helps implantation. I've never seen someone where they were staying suppressed. And how would you get your lining to grow if you continue suppression? But I guess if it keeps the endo quiet, it might work. Just got to make sure it doesn't suppress everything else, including the embryo. I've never tried that. Soraya is really excited to be on.
Super excited.
Super excited.
Big supporter. Big supporter. True. I was dreading my SIS. It really wasn't bad at all, though.
Oh, good. Did you do it with us?
The comment before that is everyone should do an SIS with Dr. V. He is the best.
Yeah, we're pretty gentle when we do them. So we do a good SIS for sure. People come from all over the place telling us it was savage and it was horrible and they passed out. And then I finish and they're like, what do you mean you're done? And I'm like, I'm done. I'm finished. And they're like, that's not possible. I'm like, yeah, it was nothing. It's always easy. So we don't torture people when we do the SIS. Well, I just think if you use the right technique, you're okay.
Can you limit the amount of eggs you fertilize? I don't want too many embryos in limbo.
Yep, no problem. We do that for people with religious concerns or ethical concerns. You can retrieve 30 eggs and fertilize 2 or 3. It's just going to cost you more if you need to do it over and over again. So I had this discussion with a couple on Thursday where she said, I don't want to do IVF because I have ethical concerns. And I said, no problem. We can retrieve all the eggs you want and then freeze them. No ethical concerns with freezing eggs. And then we can just use them as you need. It's just going to cost you more if you're only doing 2 or 3 at a time. Because if it doesn't work, every time I thaw another batch, I got to charge you to redo the ICSI and embryo growth and incubator and all that stuff. So it's a cost thing, but it's not a problem with technique.
Do you, Dr. Victory,
Mm-hmm.
have any suggestions on helping a pregnancy keep after 2 unexplained 7-week losses?
Well, we would talk. I would need to know what's going on with you, but if I'm not doing testing and you're already pregnant, aspirin and progesterone would be our go-to for patients like that. But I'd need to know you in order to figure it out. So I don't want you to jump on aspirin and progesterone because I can't tell you what to do unless you're my patient. And that tends to work quite well. It's better if you start it at the right time, though. So once you're already pregnant, it's kind of late. But yeah, those are reasonable approaches to things. There's really not a whole lot else that you can do. Just make sure your weight's good, your diet's good, you're not smoking, drinking, using drugs. Those are all important.
Can you have donor eggs shipped from the US to Canada?
As long as they meet Canadian Health Canada criteria, yes. Otherwise, no.
Treatment for...
But can I just add to
go
that?
ahead.
Well, my question would be, why would you? It's cheaper to get a fresh egg donor in Canada, which will give you way more eggs than it is to buy 6 or 8 eggs frozen from the US. So my question isn't can you? My question is, should you? And the answer is no. You should get a fresh egg donor here. It's way cheaper, and you get way more eggs, like 3, 4, 5 times the number of eggs.
I think that's a pretty good answer.
Better value.
Yep.
Yeah.
Any utility in using an HCG trigger or booster with a medicated FET?
No benefit, no advantage, and it messes up your proj control. So I got a Carly question I got to answer.
Go.
Do I perform external cephalic versions and am I good at them? Do I feel comfortable doing them? Yes, I'm very good at doing them. I feel very comfortable doing them. And I do it whenever I need to, when a patient is appropriate. Do you know what that is?
No.
No? So if the baby's bum down
Yeah.
and the head's up here,
Yeah.
you can't deliver the baby vaginally.
Oh, okay. C-section?
So she's obviously worried because her baby's upside down.
Uh-huh.
So what you do is you get the patient an epidural, which relaxes them.
Yeah.
And then you can give them a little bit of nitrous, which relaxes the uterus further. And then you have to push up on the lower part of the belly, dislodge the baby's bum from the maternal pelvis, put your hand behind the baby's head, and externally rotate the baby
No
around.
way.
Yeah.
Really?
So I'm
From the
really,
outside,
yeah,
so you're making this giant movement on
yeah,
your
yeah, yeah,
shoulder?
yeah.
Really?
And I'm really good at doing it.
Wow.
Yeah.
You're the man.
Well, no, I was actually waiting for one of my colleagues who's no longer in Windsor to come one day, and he was late and I got sick of waiting. So I just went ahead and did it myself. And then after that, I was like, this is easy. I can do this.
Oh, no way.
So I just do them all myself now. Yeah. I've got about a 70%, 75% success rate. It's pretty good.
And if it doesn't go, then you have to do C-section?
Yeah. Then
Or
you
is
just
it-
walk out, scrub, come back in
Oh.
and do the cesarean. It's easy. Yeah.
Wow.
Easy peasy.
Cool.
Yeah.
Cool.
Yeah.
You know, I learned something new today.
There you go. External cephalic version.
They should just say
Yeah.
upside down baby, no?
That's
Like,
right.
It's a complicated term.
Margot says, can I sell eggs? Not in Canada. Dear God, don't do that, please. It's a federal offense. 10 years in prison and $500,000 fine. And Soraya says, I have no man, but I will children and now.
There you go.
And then the next person said, Soraya, you don't need a man. Well, you do need a man. You just don't need a man. You need the contribution of a male, but you don't need a man. I
You need the
agree.
goods.
Yeah.
Yeah. There's a riot going on now on TikTok. Maybe scroll all the way to the bottom. Now I gotta go back out. That's okay. Hi, Dr. BNT. Any good news updates on live birth rates for first euploid FETs are transferred soon?
Depends on your age, but between 70 to 80%, 80 as high as 83% for us. I see Soraya's comment.
That's great. Give me amen. Good comments going on here. You know, there's a little bit of a.
She says, I have only sheep.
That's what we know. That's what we can see in her picture, in her emoji or whatever, in her profile picture. Just a bunch of sheep.
She's hilarious. We got to meet her.
Yeah. She's in, where is she?
The Netherlands, I
Netherlands,
think,
right?
right?
They don't have a
Holland.
conference there.
They probably do. We got to find
We
one.
gotta find it.
Yeah, we
That'd
got
be
to
so
find
fun.
one.
Is it safe to ship embryos to another clinic?
Oh yeah, it's totally safe. It comes in a hard tank that's got liquid nitrogen in it, or was cooled by liquid nitrogen, which lasts up to 7 days. That goes in a plastic shell, which is strong enough to survive a nuclear blast, and that goes with a alarm thermometer sensor, which sends off all sorts of alarms if there's a change in temperature. Usually, it's with us within 2 days max. So, and you've got 7 days of time. So we've never had a problem shipping embryos, not once.
Is there anything specific follow-up wise that should be looked at after delivering with a shoulder
Dystocia.
Yeah,
Dystocia?
Yeah.
Yeah, you probably shouldn't deliver vaginally again. It depends on how bad this dystocia was. Shoulder dystocia is when the maternal pubic bone sticks on the baby's shoulder and they can't get it out.
Oh.
So depending on how long, the baby's head is out, but it can't breathe.
Oh.
And so that's like a disaster. So you got to get those kids out quick. So I've broken this finger 100 times trying to get them out.
Oh, really?
Oh, yeah. Because you got to stick 2 fingers in, get it behind the armpit,
Okay, yeah.
pull the armpit under the bone and rotate it out. But sometimes you just can't. So then there's other maneuvers. You go for the posterior shoulder, or you have to do something called a Woods corkscrew, where you literally twist the baby and pull at the same time and try and get it out. Yeah, shoulder dystocias can be scary.
Serious?
They can be scary.
That's something.
Yeah.
Wow.
Yeah. My longest 5 minutes.
5 minutes.
Yeah.
Oh.
I was sure the baby wasn't going to make it, but the baby did okay.
Wow.
Yeah. Yeah. Thank God. Knock wood.
Knock wood. What size should the majority of your follicles be before trigger for an IVF cycle? How high would estrogen be for you to be considered at risk of OHSS?
Over 10,000, you're probably starting to get at risk for OHSS. Mature follicles are usually around 18 millimeters, so 17, 18, 19. in that range, we start thinking about trigger as high as 20, 21, 22, and as low as 16.
Does having a prior C-section decrease a transfer success?
Yes, it does actually. There's
Really?
data
Yeah,
on
I
that.
remember
Yeah,
that. Yeah,
there's data on that.
we did a show on that.
Did we?
I think so. I can't remember, but I remember.
You know what? I think we may have.
Yeah,
You're right. Yeah, yeah,
something
yeah,
with
yeah,
C-sections.
yeah, yeah.
Can you have a polycystic ovary but not PCOS?
Um, anything's possible, I guess. I haven't heard of that though. Yeah, probably not normal.
Hey, Dr. B, can we have a chat next week about endo?
Can we have a what chat?
Chat, just a chat.
Just a
I just
chat
think the
next
show.
week about
Yeah,
endo? Like you want to come on live?
I think they want an endo episode.
Yeah, I'll happily do an endo episode. Sure. Or come to the Canadian Fertility Show where I'm presenting on endo.
Bam, there you go.
There you go.
What is the maximum number of CA-125s that can go under IVF? Mine is 50.2, and one doctor told me no, and the other said I can start IVF. I'm so confused.
What does CA-125 have to do with doing IVF? It's a useless marker. It can't predict anything except for follow-up of ovarian cancer. If your doctors are making decisions based on CA-125, they both have no idea what they're doing, so ignore them.
That sucks. That's two doctors.
Yeah, that's two
That's
annihilated.
gone. With the
Yeah.
That's wild. What are your thoughts on scheduled C-sections for the first time mom? I think I would feel safer that way.
Detrimental to you, detrimental to baby, harmful for a variety of different reasons, compromises your future fertility, increases the risk the baby will go to the NICU, increases allergies, increases respiratory difficulties, worse for bonding, worse for breast milk. So I never recommend it, but if you want it, sure. You shouldn't feel safer getting a cesarean. It's not safer. It's more dangerous for you and for the baby.
So why would somebody want a scheduled C-section over just a scheduled?
Some people are nervous, they're anxious, they're worried, they think something's going to happen during labor, that we're not cautious enough, that kind of thing. Which can be the case. I mean, some places aren't cautious enough. We're very cautious. I'm very cautious.
Do you perform ECVs? Do you feel comfortable doing
That was
you did that.
Carly, yeah.
Is it a long wait time to get an appointment once referred?
Couple of months. We're having a new doctor join us starting day after tomorrow. So it'll be faster because we'll be letting her share in some of the consults. Yeah.
Which cycle day do you usually start Orgalutron on?
6, 5 sometimes a little bit later, but usually 6.
Hey, Dr. B&T, I had a blighted ovum with PGT tested highly graded embryo.
Wow.
The ANORA test also came back normal.
ANORA?
First miscarriage. Do you recommend any testing before the next transfer?
Yeah. I mean, that's unusual. So I'd probably do Fertility testing to see if there's an infection or a problem with your immune system.
What are your thoughts on a scheduled?
Don't do scheduled C-sections. I mean, I do them, but reluctantly.
AMH of 10.6.
Yep.
AFC of 18.
Woohoo!
Age 37.
Yeah.
Is that decent?
That's awesome.
I think the woohoo said it automatically.
Yeah.
I was like, I know the answer.
That's a good one. Yeah.
Is it possible to develop endometriosis after having a C-section?
Yeah, sure. You can have iatrogenic endometriosis where they evert the lining of the uterus into the scar, and so you're sprinkling endo everywhere. It's very common.
Oh, here we go. NMN. I got two people giving us the definitions here. Nicotinamide mononucleotide. Is at the bottom.
Nicotinamide? Oh, I looked that up ages ago. Honestly, I don't remember the data on that, but it wasn't convincing.
Male factor infertility regarding poor motility and potentially mild endo. Does IUI give good chances? And what about a natural IVF transfer?
Natural IVF transfer will. IUI, I mean, it depends on your definition of good, right? So your chances with IUI are probably somewhere between 5 to 15%, depending on how you do it and who does it for you. Yeah,
How long after first ejaculation should the partner wait for a better semen quality for IVF or ICSI?
3 hours.
What are the over-the-counter supplements you recommend for endo patients?
Curcumin, NAC, resveratrol, ALA, and CQ10, coenzyme Q10.
About to do IVF, just got over a cold. About to start stims on Tuesday. Should I postpone?
If you're over the cold, no. If you're not over the cold, yes. We did a presentation a couple of weeks ago, well, it's probably more than that now, a month and a half, 2 months ago, on checking your white blood cell count to predict your success rate. And if your white blood cell count shows high lymphocytes and high neutrophils, then you don't do as well, and high platelets as well. So get yourself checked out to make sure.
Hello, doctor. Please, does sperm motility affect a male's fertility? And if yes, what is the solution?
Yes, for sure it does. Solution, same thing as all the other guys. So Tarek would know this one by now. So no smoking, no drinking, no drugs. And by no, I mean zero. And that includes hookah and shisha and all that stuff. Vitamins for men, eat healthy, ejaculate every day or every 2 days, and keep your testicles cold.
So I got an interesting situation.
Okay.
I know some women.
Yeah.
Get ready for this. This is great.
Okay.
They smoke hookah.
Okay.
You with me?
Yeah.
They go to the doctor.
Yeah.
Doctor asks them, do they smoke?
And they say no.
And they say no.
But they're smoking hookah.
Yeah.
Well, that's still smoking.
Classified as smoking. So when a doctor's asking,
Hookah is smoking.
hookah's smoking.
Yeah.
She's smoking. That's all smoking.
Oh, yeah. Absolutely. Yeah. And it's terrible for you. And they're like, no, it's only fruit. I'm like,
Yeah. It's watermelon flavor.
yeah. It's full of a bunch of crap.
Hi, Dr. Victory. I'm wondering if you have any suggestions on ways to help a pregnancy stay, after two back-to-back unexplained 7-week losses.
We did that one.
Yeah, we did that one. How can a Quebecer
Yeah.
get Dr. Victory to do an endo excision surgery? Would you be able to do a single port, single incision surgery? Afraid of scarring. Thank you.
No, because we don't have single port. And to be honest with you, I think it's a silly procedure. And as a Quebecer, you'd probably have a hard time getting me to do your surgery. So I wouldn't try that. I mean, there are some provinces where they just can't get care, like Newfoundland, like the care is horrible there right now. They don't have doctors. So they're waiting like years to just see somebody.
No way.
Yeah. So we can help them. But in Quebec, you probably have a very tough time justifying coming here. I'm happy to do it. Don't get me wrong. But I don't do single port surgery. Having said that, the incisions are tiny and we keep them in your bikini underwear line. So unless you're doing OnlyFans, it's not going to be a major issue. If you are doing OnlyFans, yes, you will have a scar.
Sophia says, I will come to you and find a man there since there are only farmers here. There's some good comments here.
Oh, that's funny. SMBCC, I already said which endo supplements I use. They should be started as soon as you can in advance. And Dr. VNT, do you do scheduled inductions for IVF patients? I thought I heard 38 weeks, typically 39, but yes, we do. Yeah, I do OF and I have so many endo scars. Carly, we love you.
What dose of Tacro would you recommend for high TH1, TH2, TNF, AIL10, CD3 plus CD4 ratio, which is 34 for me? Which NK cell parameters to consider apart from CD56?
So we would use the Tacro at either a dose of 2 or 4 milligrams. It comes in 2s and 4s. The studies use 3.6. I don't know how they got it, but we would use either 2 or 4. CD56, CD58, you can look at that as well. We look at T regulatory cells as part of the Fertility testing. So those are the sorts of things we look at. And then they look at the cytotoxicity and the inhibition by intralipids.
If I took an ovulation test 2 days before my period and it's positive, can I be pregnant?
Yes, because it'll cross-react.
I could just ask on Friday, but do you offer paid ultrasounds outside of the typical OHIP ones?
Yes, we don't recommend them, but we offer them. And I don't publicize that.
Hi, Dr. V and T. I'm meeting with you on April 18th.
You or me?
I was about to make that comment. I don't have that in my calendar.
Okay, April what? 18th?
April 18th.
Okay.
Anything I should send you before the meeting?
No, just bring stuff with you, please.
How would you treat MTHFR homozygous?
Aspirin and heparin. I love the gimmies. They're so easy tonight. This is great. We got to do more of these. Soraya says, okay, Habibi, I am coming.
There we go. She's fed up with the sheep. She's protesting the sheep.
Tarek's going to have to find you, man. I have Tarek as my only friend, and then the rest of the time I work. He's connected to the community.
He knows people. Hello, dear Dr. Victory and lovely Tarek. This is.
Oh, see, that's very heartwarming.
I wait all week for something like that.
Yeah.
4DP5DT.
Okay.
Is it normal to feel any symptoms? So anxious, 10th transfer, finally modified natural.
10th transfer? Wow. No, you should feel nothing. It's too early.
How can I approach my doctors about MTHFR treatment and heparin shots once I'm pregnant again? I've had 3 miscarriages before, and they think MTHFR, it's not important, even though I have the worst mutation.
Well, you shouldn't wait until you're pregnant. That's the key. You should be on aspirin before and ideally heparin before as well. So switch doctors if they're not listening to you. I mean, that there's nothing else to do. Or sit them down and show them studies and say, this is why I want this. Soraya wants to know if one of us has a brother. I don't. I got his sister. Tarek has a brother, but I don't believe he's available.
He's also taken.
He's also taken.
Yeah. I'm 42 and failing to get pregnant. What can help?
Oh, you'd need to see a fertility specialist. We'd have to figure out why you're not getting pregnant, and then we can address what can help. It's not like I can just tell you magically, take this pill and it's going to make you better. It doesn't work like that. I need to know why it's not working.
Does taking Diogist for a prolonged period of time before
Diagnostic?
Diagnostic.
Yeah, that's Vizan.
Time before prolonged period of time affect your chances of getting pregnant?
It should improve it if you have endo, and there's studies that show that it does have that it does improve things. Soraya says I can have 4 wives.
There you go.
I'm Baha'i, Soraya. I cannot have 4 wives. He can, but I think his wife would kill him if he suggested.
It's gotta be a compelling argument to go to war. You know what I mean? It's gotta be a compelling argument. That's for sure.
Yeah, I got 1 wife. More than enough for me for my lifetime. Yeah.
Thoughts on mirror device for monitoring hormones at home?
Stupid and useless. Don't believe that hype. It's a bunch of garbage.
That's the second best answer today. Just
Yeah.
letting it out. Doctor recommends Lupron for FET protocol, but no endo. DX is unexplained. What's the benefit of Lupron for me?
Nothing if it's for endo. Now, the Cochrane meta-analysis review database has a study that demonstrates that Lupron does improve your chances of success prior to frozen embryo transfer. So we use it for all of our patients because of that study. But if you have endo, Lupron alone is insufficient. It has to be Lupron plus letrozole. You have to use it for a prolonged period of time.
Do you recommend doing more lip treatments if two partner and two donor haven't had much impact, still have low LADs?
No. If you've done 2 donor lit and you still have low LADs for whatever reason, you're just not mounting a response. And that's not safe to keep firing in other people's blood under your skin. Sooner or later, you're going to have some kind of bad reaction. Tarek agrees. He's vigorously shaking his head
100%.
off
That's
camera here.
something's not right there.
Something's not right there. I agree.
How to fix an isthmus seal?
So an isthmoseel is we draw this, we should just have a picture of an isthmoseel. My pen just died. Why did my pen die? Let's do it with the big black guy here. Okay. So that's your isthmoseel right there. I'm going the wrong way, right there. So the way to fix it is to resect it here and a little bit here so that nothing can get stuck in it. So you're basically trying to chop this part off, and same thing there to make it smoother so it can get, the blood doesn't get trapped in there. So you got to resect it out a little bit. It
Dr. Vinci,
requires hysteroscopy.
Dr. Vinci, do you schedule inductions for IVF patients? I have heard 38 weeks typically.
We did that one.
Okay.
Yes is the answer. We schedule inductions.
What's the difference between endometriosis and endometritis? And can you have both?
What's the difference between who and what?
Endometriosis and endometritis.
Endometritis is an infection of your uterus. Endometriosis is the presence of the cells from the uterus outside of the uterus. They're 2 completely different things, and yes, you can have both.
Mild hypothyroidism and Hashimoto's levothyroxine is helping. What do you think about LDN? And does this add into a protocol help with implantation?
I'm not convinced by the LDN data yet, guys. People ask me this every show, but I'm not convinced yet. It might help. I'm just not convinced yet.
Does CoQ10 really work on egg quality? Does
Yes.
ubiquinone work the same way as ubiquinol?
Yes, and yes.
Can we take melatonin while being on Lupron and letrozole? Also, can we continue it in pregnancy?
Yes, and yes.
Wow, nice.
Lots of yeses.
Yeah, I see that.
Yeah.
Can we have or develop MTHFR after one baby? Did not have any issues falling pregnant first and now back to
No.
MC.
It's a genetic thing, so it's not something that developed. You had it before. You just got lucky and it didn't manifest, so that's fine.
After letrozole, 3 follicles developed: 15 millimeters, 21 millimeters, and 22 millimeters. Would an HCG result ovulation?
Would an HCG result in a... If you took HCG, would it make you ovulate? Yes.
How to regulate levo dosage in hypothyroidism patients?
It's weight-based, and then you got to follow their levels carefully. So you start on a level based on the weight, and then you follow their TSH and T4 levels carefully.
Hello, doc. Is there something I can do to naturally conceive a baby boy?
No, there is nothing you can do that will alter whether or not you have a boy or a girl. All that stuff you read about online, it's all BS. Chinese calendar, hot, cold, eat yogurt, have sex 3 days before, have sex 4 days. It's all BS. It doesn't make any difference. Total nonsense.
Somebody told me potato chips in bed. Guaranteed boy.
Did it work?
Never tried it. They just told me.
Yeah.
They said it gets them primed for sports.
There you go. Oh.
Is TSH 2.5 enough for conceiving?
Yes, it's perfect. You want it less than 2.5.
Reason why PCOS patients don't have a period for 3 months. What could cause this?
Because you're getting very high levels of estrogen, but you're not releasing an egg. So that's why your period doesn't come. So you need to make yourself release an egg. Your eggs start to produce, but they don't mature and release. And because they're not maturing and releasing, you end up with a lot of estrogen, but no progesterone. Only way to fix it is weight loss, and then medications and supplements.
How is long protocol better than short protocol for stimulation during IVF?
It isn't. That's nonsense.
Hey doctor, can a woman get pregnant on Synthroid for 10 years?
Sure.
What do you think of priming with 2 to 3 days of Centrotide before stimming? They do this at CCRM sometimes to lower LH before starting stim and prevent lead follicle.
Yeah, I've heard of that. I haven't seen any studies on it, so I can't comment on it, but I'm not sure. It wants you to verify on TikTok. You got to slide that little puzzle piece over the other
Bam,
one.
solved
Yeah.
it. Oh, why didn't I like that?
It did that to us last time too.
Really?
Yeah.
That's wild.
Yeah.
They just want
We're
to
we're past an hour.
that's why.
Yeah.
Something's wrong here.
Let's wind it down.
Sure. Uterine PRP for thin lining.
It's awesome. It works really well.
Is there a way you can test for genetic testings for unexplained infertility? Just an FYI, I had 5 miscarriages, 1 ectopic pregnancy.
Well, you need to have genetic testing. So yeah, absolutely. You should have karyotyping.
Do you induce all your patients or just IVF patients?
I offer induction to all my patients because the ARRIVE trial demonstrated that it's safer and better for mom and for baby, but I don't force anybody into anything.
Opinion on the Aura ring for temperature tracking.
Useless. Don't bother tracking your temperature. It's of no benefit whatsoever, and it drives everybody crazy. So don't do that. Just get an LH kit, pee on a stick. You know when you're ovulating.
They're trying to convince. I don't know who they're trying to convince, but they want if you bring him brownies, that's the trick.
That is actually true. I got a big dish of brownies the other day.
Really, the other day?
Yeah.
That's nice.
Yeah.
Brownies are great.
A whole dish. I had to leave half for the labor and delivery ward, but I took the half for myself. Had
How do you bring
icing.
that?
It was missing some walnuts, but it was very good.
You know-
Thank you to the patient that gave it to me. Yeah.
Went a long way.
I can't feed you, man. You're
Yeah, I'm
fasting.
fasting, that's true.
Yeah.
Hello, dear Dr. Victory and lovely Tarek.
Okay, let's make this the last one.
Okay,
Yeah,
4P5DT.
we did this one.
They asked it again. So anxious, tense transfer, finally modified natural. Is pregnancy possible? Oh, last question. Should I look for it?
I don't know. Sure, look for it.
All right, I'll look for it real quick. Okay.
Let me answer this one.
Why?
Hi, Dr. Victory. Does a stage 2 prolapse need surgery? Only if it's bugging you. You should never do prolapse surgery unless you have a problem with it. And someone else asked if they should remove their 7-centimeter endometrioma before they have another baby. Yes. Because if it gets any bigger, it could twist your ovary, and that's a huge problem.
All right, here we go. Here's something I never heard of.
Okay.
How about taking Medrol as part of my FET protocol? My doctor said it is for inflammation, and I'm doing 3 months suppression due to suspected endo.
Yeah, we use Medrol before every FET. That was an easy one.
Seems too easy.
That was too easy.
Okay, I didn't like that answer. Do monitoring for Ottawa? Yeah, no problem. We can monitor from anywhere.
Yep.
Why doesn't the US do lit therapy? Here we go.
I have no idea. No clue. I'm kind of glad they don't because it helps bring all the patients to us.
They don't even do it.
No.
Oh, that is so interesting.
Yeah, not done there.
Okay. Hi, Dr. Victory. Does stage 2 prolapse need surgery?
I just answered that one.
Oh, they're just
Yeah.
everywhere.
They're asking all this.
Oh, start
over
a
the
side
place.
hustle of matchmaking. There you go, Dr. Victory. Start a side hustle of
Matchmaking? I don't think I'm going to do that. Here's a couple. What are my thoughts on HCG booster and wash? Booster is useless. Wash has been proven to give you about a 30% increase in success. How much is my IVIG? I don't have my IVIG. but IVIG is insanely expensive. It's about $5,300 to $5,400 per treatment. It's very, very, very expensive.
I got a good question.
You do? You got my question? All right, fire away.
Would you do a Lupron protocol pre-FET for someone who has just discovered they have one spot of endo during a laparoscopy for ectopic? Surgeon was a specialist
And
and
removed it.
said endometriosis was minimal.
I'd have to know how minimal. If it was truly only one spot, probably not. But if it's more than one spot, yes, we would. Okay, let's wind it down.
Wind it down.
Have a good night, guys. We love you all. We will be back on Tuesday with or without my esteemed colleague, Dr. Tarek.
Yeah.
And we will be back. But thank you for joining us. And happy Easter to you all. God bless. Everybody have a good night. Soraya, thanks for always making it entertaining. And lots of likes. Much appreciated. Enjoy your little chocolate Easter bunnies. Lint makes the best ones. I think we've well established that.
I actually like the giant one. I'm not gonna lie.
From Lint?
No, just any
Like
giant
bunny?
bunny that I can like rip its ears off. Somehow there's a satisfying
Ow.
crunch and the disfigurement that goes along with it.
You're really into disfiguring bunnies? You're just going to tell people that?
The chocolate bunny is unique. I like a nice real bunny that hops.
There's a whole side of them I never knew about.
But just biting the ear, and then you have like, and then you gotta like gnaw at it because it's so big.
They are big.
There's
Yeah.
like,
The Lin ones are the best, though.
Lint is usually.
Yeah. Yeah.
But when you buy these things, 'cause I got
The day after.
the day after.
I know.
You know, they're just giving it to you. And I just throw it at my kids like I'm the Easter bunny. You know what I mean? Here you go. Eat.
Yeah, they might get a little religious confusion, pal.
It's
But
okay.
yeah, you're okay
I'm
with
okay with that. Let them enjoy the chocolates.
All right, have a good night, guys. I'll talk to you all later. Bye. Soraya wants us to look for a man for her.